Benaria White, and I am going to be your nurse today. And I'm just going to check your chart to see what's going on. Can you state your first and last name? Sally Jensen. Okay, and when is your date of birth? July 21st, 1982. Okay, great. So we just got the order that you're going to be getting a Fowley catheter placed inside of you today. And a Fowley catheter is just going to help you empty out your bladder, and it's also going to help you void properly. You're having difficulties voiding, so we're just going to help you out with that today. So before we get started, I'm going to perform hand hygiene, making sure that the door is closed, making sure that we are keeping privacy, and then we're going to get started. So I'm performing hand hygiene. Okay. So we're going to have to expose our patient today. So I'm going to take the cover down to your feet. You might get a little cold, but it'll be okay. And before we get started, I need to just ask you, are you allergic to any iodine, betadine, or latex? No? Okay, great. So I'm going to expose our patient, get them to a working height. Okay, I'm at a working height. And I'm also going to place the patient in dorsal recumbent position, and this is going to help be able to get to the perineum. And so before I came in, the patient already received perineal care, but if she hadn't, I would just put on clean gloves, and I would perform peri care with a warm washcloth, and then I would get started with the procedure. So we're going to be placing a Fowley catheter, and each hospital is a little different, and it's always going to come inside of a sterile package that you're just going to take all your material out. This package is a 16-inch Fowley catheter that will be inserted in the patient with 10 milliliters of water to secure it, to secure the bulge on the inside. And so to get started, we're going to go ahead and place our package in the bed and get our sterile field ready. When during this procedure, some people like to use a trash can to throw away all the material that they won't be using, but I would just be using the bag that it came in, and I'm going to place it right here. It makes it easier to throw away and makes it easier so that I don't have to contaminate my sterile field by reaching over. So I'm going to put this right here. So now I'm going to open from the outside. So now I'm going to get my sterile gloves, and I'm going to try not to reach over my sterile field to get them, and they're right there. So I'm going to grab them, and I'm going to take them over to this.
This is the last time we're briefing.
Okay, now that the gloves are on, I can adjust them how I need to, and then we're going to get started. here is a fenestrated napkin that can be used on a woman, and this just helps to create your field more sterile. But sometimes if you're not really a pro, then sometimes it can make it harder to contaminate. So I'm not going to be using the fenestrated napkin today, so I'm just going to throw that in the trash. And so now I'm going to prepare my tools. Fluff up my cotton balls to clean. I am going to set my specimen cup to the side. And then I am going to open my Fowley. Being careful not to drop the catheter anywhere outside of my sterile field. And then I'm going to take the iodine and pour it on my cotton balls. Taking my lid. And then I am going to take my syringe of sterile water and attach it to the Fowley catheter, so I don't have to do this once I touch the perineum area. I'm going to sit this there. Okay, now that I have everything together and I'm ready to insert, I'm going to place my hands on the labia and I'm going to spread until I see the urethral meatus. And I'm going to clean one side, not reaching over my sterile field, dropping. Clean the other side, avoiding my sterile field, dropping. And then once more down the center, taking it and dropping. So now I'm going to take my catheter. I am going to place it inside of the lube. I want to lubricate 1 to 2 inches. And then I want to insert it inside of the urethral meatus 2 to 3 inches. So inserting the catheter, I want to go until I see urine. So I see urine. It is yellow, good consistency, not cloudy, and I want to keep inserting 2 to 3 inches past that. Okay. Now that I have inserted 2 to 3 inches, I'm going to take my syringe of 10 milliliters of sterile water. Okay. Now that it's in there, let's spread the labia and I'm going to pull until I can feel pressure. I feel pressure, and now I'm going to, and then I'm putting my syringe, drop. And I'm slowly putting this down. And now my hands are dirty and I'm going to take them off properly. And I'm going to secure the catheter on the patient's leg. And now I'm going to put clean gloves on to take everything. All of this will be thrown away in the trash. And the urinary drainage bag is going to go on the side of the bed. You don't want to attach it to a rail, or you don't want to attach it to anywhere on the bed where it's going to be moved. So you want to make sure that it's going to be secure on the side. Okay. So now at this point, now that we have it secure, I want to make sure I perform perineal care. So I'm going to wipe each side, and I want to wipe from front to back. And then also, if the doctor wants a urinary specimen, I'm going to take a specimen. If it's fresh, then I'm going to take it from the bag. But if it's been a few hours and I've left and I've come back and I need to get a urine specimen, I'm going to take it from this port right here. I'm going to take a syringe and I'm going to get it from here. Okay. So now that the patient has a urinary catheter in, and I'm going to now take my gloves off, perform hand hygiene, make sure that the patient is comfortable putting their legs back down, covering them back up, and then asking them if they have any questions. Do you have any questions for me? And also, if the patient experienced any pain through this procedure, I would have stopped the procedure, taken out the milliliters of water that I inserted in the catheter, and then I would have removed it. But the patient didn't experience any pain or any pressure, so the catheter was placed. So now I'm gonna leave. Okay, coming back in to check on you. How are you doing? How's it been? Okay. Can you state your first and last name? Okay, and your date of birth? Alright. So the doctor has given an order for you to get your Foley catheter taken out. So we're gonna start by doing that. I'm gonna get you back to a working position. How are you today? Are you doing okay? So to take the catheter out, we're going to have to expose our patient again. And we're going to put on a clean pair of gloves. I'm going to perform hand hygiene like always. Make sure that the door is completely closed for privacy. And I'm going to put on clean gloves. And to take the urinary catheter out, a syringe would usually come that's already clean and sterile. We wouldn't use the same one that we already used. So I'm going to pretend like I got a new sterile syringe to get it taken out, but I didn't. So here's our clean sterile syringe. Okay, so I'm going to be taking it out, so I'm going to make sure the patient is okay. I'm going to place the syringe back in there. And I'm going to take all 10 milliliters out. Okay, now that I have gotten all 10 milliliters out, I'm going to unhook this and I'm going to slowly slide it out. And a towel would have been here because usually when you take the catheter out, there's going to be a little residual urine that might flow out, so we would have a towel there, and then after I take it out, I would place it in trash. Then I would get a towel, warm water, and I would perform pericare. And then take off my gloves, perform hand hygiene, cover the patient back up. So now I would document, and to document for this patient, I would state the Foley catheter that I used, the inch, it was 16 inches. I would also state how many milliliters of sterile water that I used. I used 10 milliliters of sterile water to bulge the catheter, and I used 10 milliliters to take it out. I will also measure the amount of urine that I collected in the urine specimen, and I will also measure the content, if it was yellow, cloudy, or the smell perhaps. Also, when taking it out and putting it in the urine, I would make sure that I have eyeglasses. I would make sure that I have on a mask so that it wouldn't get in my face. We don't have those things right now, but if this was a real thing, I would do that. And our patient didn't experience any pain or through this procedure. And so that's it.